Hi, my name is Alessandra Bice, and I'm going over prenatal education video number 2. We're going to start by discussing foods that should be avoided during pregnancy and why they should be avoided. So, first, we want to talk about mercury. This occurs in fish like tuna, sushi, stuff like that, which you want to stay away from because it can cause birth defects. Second would be any undercooked poultry, meat, anything like that, because undercooked meat can cause illness and can also cause damage to the baby if those bacteria or microorganisms were to get the mother sick. Third would be just unwashed produce. You can get Listeria or E. coli, which can also affect the baby. And then we would want to move on to educating the mother on over-the-counter supplements and medications that can be used and those to avoid. So the mother can take Tylenol for pain, or otherwise known as acetaminophen. Tums for heartburn are okay. Claritin because it's a second generation antihistamine. Some antihistamines are okay and some are not. Claritin is one that is okay to take. And then supplements we would want the mother to take are folic acid to prevent neural tube defects, and then a prenatal vitamin that has calcium and iron. We would then want to go on to discuss environmental exposures that the mother should avoid while pregnant. First, we would want her to avoid cleaning chemicals. A lot of these can be really harmful to the fetus and cause birth defects. Second would be secondhand smoke. That can also cause a lot of problems for the fetus, such as defects or preterm birth. Third would be pesticides. These also can cause severe damage to the fetus, such as birth defects. And then lead, which can also cause some severe birth defects in the fetus. Then we would want to move on to discuss the effects of alcohol and tobacco on the fetus. Alcohol, there's no safe amount of alcohol that a mother can consume. It can cause brain damage for the baby, birth defects, and fetal alcohol syndrome. It can also cause the mother to miscarry or have a preterm birth. For tobacco, you would want to avoid it. It especially can cause effects in the mouth and lips. It can cause preterm birth, low birth weight, and miscarriage or loss of the fetus for the mother as well. Overall, just stay away from alcohol and tobacco while you're pregnant. Especially other drugs like recreational drugs are also not good because they can cause brain damage for the baby, especially while their brain is developing, as well as other birth defects that are unknown. We would then want to go on to discuss travel precautions while pregnant. Generally, it's pretty safe to travel, but it should be done before the 3rd trimester, just in case anything does happen, like a preterm birth or anything like that. Of course, always wear your seatbelt. Swelling as often occurs with traveling, so loose clothing, loose shoes. There's usually some ankle swelling and edema down there. They say like flexing your ankles or getting up and walking around can help prevent DVTs, edema, stuff like that. Also, when traveling, you need to stay away from like fresh produce, stuff like that, just because it could have Listeria or E. coli. So usually hot or packaged foods are safer, and bottled water to prevent illness or the transmission of bacteria, just because traveling borne illnesses are very common. You also would want to meet with your provider prior to traveling to make sure there's not any vaccines or extra precautions that you would need to take. And most airlines do not allow pregnant women to travel after 36 weeks just in case of preterm labor. We also would want to discuss going to the dentist. This is usually safest in the 2nd trimester just due to needing x-rays or procedures or anything like that. You wouldn't want to expose your brand new baby fetus to x-rays, so they usually have you wait till the 2nd trimester. For any like dental pain that you're having, most medications aren't safe for the fetus, so Tylenol is often what is prescribed for dental pain. And then if you do need a procedure, it's usually best if you can wait until after you deliver. And that will conclude my video today. Thank you.